Okay, so Lauren, thank you so much for joining us on the patient story today to share what you went through.
Thank you for having me.
Let's jump right into it. I know that this happened, a few years ago, but still pretty fresh, I imagine, in your memory. Yeah. How did you know what were the first symptoms? How did you know something was wrong?
So my first symptom was fatigue, actually, followed by bruising, like lots of bruising. So started with simple bruising. I was able to kind of touch my skin and a bruise would pop up and it would look like somebody beat me up. um, Started there and I just kind of kept writing it off, just saying maybe it's stress, maybe it's stress. My job at the time was very stressful. I work in the medical field, so it was very stressful at the time. And I just kind of wrote it off as that. Shortly after, I think probably I bruised for about a week and a half. And my mom finally told me, she's like, this is not normal. You should not be bruising like this from stress. Something's not right. And she really pushed for me to get that first doctor's appointment, which is when I found out pretty much everything. Went to the doctor for the appointment on a Friday afternoon. And the doctor pretty much thought everything was fine. He said, it really could be stress, everything going on with your job, things like that. So I want you to just go home and relax with your kids. It's going to be nice weather this weekend. But before you leave, I just want to get some extra lab work. I want to go cover all my bases. And he drew a few more labs before I left, and I went home. Went home, got my kids from daycare, and we were hanging out. And about 6 p.m., I got a call, and I knew something was wrong because the doctor was calling me personally at 6 o'clock on a Friday.
Yeah, and you
And
know that can't be good.
yeah,
Um,
that's never good.
um, so Okay, so, yeah, the doctor's calling, it's Friday, never good news. What did that call come down to say?
So that call came down to basically say, hey, I need you to get to the emergency room immediately. And my response was, okay, well, you say the nearest emergency room quickly. Do you want me to go to your facility at Emory, or do you want me to go to just my nearest hospital? And he's like, no, I really would prefer Emory. I'm going to call the ER and let them know you're on your way. Your white count is extremely high. Matter of fact, it's the highest I've ever seen. And so I was like, okay. And at that point, I'm already just freaking out. I'm thinking in my head, okay, maybe it's just sepsis. And because about 3 weeks before that, I felt like I had strep throat. And my doctor that I worked for prescribed me medication for it. I took it and it was gone for a while. It wasn't hurting again or anything like that. So I was like, okay, it was just strep throat. And so in my head, I'm like, I should have had more medication. I took all the medication he gave me, but maybe I didn't take it all. Now I'm severely infected if my white count is that high. So I immediately dropped off my kids with my mom and went to the hospital. Got to the hospital, checked in, and I sat there like there was no urgency at that moment. I think I sat in the waiting room for about an hour and a half. And then they called me back to the triage area, and but they didn't do any vitals or anything like that, which I thought was funny. Immediately a doctor walks in, so I'm like, okay, what's happening? And he's like, well, the first thing he said to me was, wow, you don't, I mean, you look fine. You don't, and I'm like, okay, well, what's supposed to be wrong with me? And the next thing he said was, I've already consulted hematology oncology. And as soon as he said that, I was like, wait, oncology? Like, I have cancer. And he was like, oh, you didn't know? I'm like, no, I did not know.
Oh my gosh.
So
That's
yeah,
really
it
kind
was
of bad.
quite shocking at that moment.
So you're sitting there, it comes completely out of left field. Yeah, how are you I mean, I'm sure you're not processing. How are you processing this information?
So I really think at that moment I was still in shock because I was actually sitting there in the room, in the triage room, playing on a tablet. I remember just playing little games on the tablet when he came in. So when he said it, and then when he asked me, when he said, you didn't know, and I'm like, no, I didn't know. And so he asked me, and he said, "Is there anyone here with you?" And I'm like, "Yeah, but I feel like they probably should have been sitting next to me when you told me this, because now I just want to fall out." So he said, "Well, who's here?" And my husband was there at the time. So I said, "My husband is here." And he was like, "Okay, well, go ahead and grab him." So I went to the door to have my husband come in the room. The doctor walked out of the room at the time. And so he came in and he was like, "Okay, what's going on?" And I said, "He just told me I have cancer." And he's like, "What?" I said, "Yes." He just told me he was consulting hematology oncology and they were coming to talk to me. The doctor would be here shortly. I think he was a lot more shocked than I was. He kind of just sucked down in the chair, and I was looking like, I don't know what just happened. Like, I literally went from being pretty much healthy 3 hours ago to now someone telling me I have cancer.
And so young, right? I mean, at the
Right.
time, how old are you at the time?
At the time, I had just turned 26. My birthday is on January 12th. I got diagnosed on January 30th.
Wow. Okay.
Or I went to the
Um,
hospital. So yeah, pretty much diagnosed on the 30th. They didn't know exactly what type of leukemia I had, but I got diagnosed on the 30th. So I just turned 26.
and and Lauren, so and I'm looking at your timeline. So I mean, that primary care and the ER, that was January 29th, right?
Correct.
And then so let's walk through the next step. So you tell your husband it's an insane time, right? You're both trying to process this news. You go
Right.
back and then what do you find out next?
So then the hematology oncologist comes in and he says the same thing. He's like, For your current white count, like, you look amazing. Like, I would really expect you to look very weak or to even possibly be in a coma." I was like, "Wait, what?" So that was quite shocking. And I asked him, I just asked, I said, "So what kind of cancer is it?" And he said, "It's leukemia." And I said, "Well, how do you get that? Like, is it something I did?" And he said, "No, it has nothing to do with your lifestyle." And he asked all the lifestyle questions. "Do you smoke? Do you drink?" All of these things. And I said, "No, I don't smoke. I drink wine. I said, if I do, I may go to the Mexican and have some margaritas, but I'm not like a lush. I'm not drinking all the time." So he's like, "No, it's nothing. This is one of those that we can't pin down where it came from." And so and I remember him asking me, did I have any questions? And I said, "Well, yes." I said, "So what are the next steps? Like, do I go home?" And he said, "Oh no, your white count is way too high. We are not sending you home. You will be staying and you will start on chemo pills." And he just started rambling through stuff. And I was like, "Oh my gosh, this is real. This is real."
Doesn't get any more real when he starts to list off all these things that you're supposed to start taking and you're not
Right.
going home. And meanwhile, you have one daughter, you have,
I have a daughter and a son. So at that time, my daughter was 4, my son was 2.
and so I'm sure one of the first thoughts is, wait, I have kids. I can't just be staying here, right? How'd you handle
That,
that?
that was over everything. And it was so vain. And at the time, I was like, I didn't even bring clothes. I was like, I have nothing. I was like, you got to at least send me home and let me come back and be inpatient on Monday. You can't keep me here. I just got here. I have no clothes. I have no toiletry bag. I didn't get to say bye to my kids. I didn't get to kiss them. Who's gonna watch my kids? Just all of that was what was on my mind. Not, okay, well, let's go ahead and get started. That was the last thing on my mind.
Of course, yeah. I mean, you're thrust into this thing. So how did you do next steps? Like the doctors told you all these different things. You're like, give me a second. What happens next?
Right. So next, they did tell me I had no option. I mean, unless I went AMA, I had to stay. We had to start the treatment. He told me, he said, "Your levels are extremely high. Your levels are so high that if you had not jumped on this, I would have given you maybe a week before your organs started to fail." That's when it kind of kicked in for me, and I was like, "Okay, yeah, this is serious. I just forget everything else. I got to get started because I got to live for my kids. Like, I don't want to go home and something happened to me. So we just got to go ahead and get started." They took me to a room, told me I was going to kind of be in one of the overflow rooms until they could get a room for me on the leukemia floor. So we went there and I got in. They got me on a gown and everything. And I would say from the time I got into that room, I was in there maybe for an hour, hour and a half, and the nurse was coming in with the chemo pills. I
Wow.
was like, yeah. It's like I was just like, oh, like we start this tonight, like now. And she's like, yes, ma'am. She's like, these are the orders. So she starts going through and telling me everything that I gotta take and how it may make me feel. And I was just like, this this is crazy. So I did go ahead and took everything I needed to take. And I think at that point is when it finally hit me and I kind of broke down. I had a whole meltdown at that point. I could, it was just like, this is real. Like I just took chemo pills. I have cancer.
So at that moment, you're finally emotionally letting yourself process this, right? The shock is starting to subside a little bit.
Right.
How are you able to calm yourself down again or get through that sort of, emotional
So
time? Yeah.
at that time I was actually working for an orthopedic oncologist. So it was, it was awkward because it's like we treat cancer all day and now I have cancer.
Mhm.
And I remember sending him a text message. It was probably at that point, it was probably about 1 or 2 in the morning. And I texted my doctor I worked for, and I was just like, this is crazy. I was like, I was like, I know, I left work early to go to the doctor. I am currently in the hospital and have been diagnosed with leukemia. And he immediately called me and was like, Lauren, what? He was like, wait, what? And I said, no, why are you? And I'm still thinking of everybody else because I'm like, why are you up at 2 in the morning? And he's like, I was up. He's like, I'm on my way to get some coffee and do some work. And you sent me that. So I had to call you. And he's like, wait, when did all this happen? Like, and so I just started telling him everything, kind of explaining everything to him. And he said, don't worry. Don't worry. He said, okay, I'm going to be blunt with you. If you had to get cancer, this is one of the best cancers to probably get at this point. And if you were going to get it, now is the best time to get it under 30. He was like, your treatment is going to be pretty rough, but now he was like, you're in good health. You can fight it. You're going to be okay. You're going to get through this. And I think that was what was reassuring for me because he was in the field, he's seen it a lot. That's what he has done for the last 15, 16 years. So to hear that from him just kind of helped me stay positive at that moment that, okay, you're going to beat this. You're going to get through this. You just got to fight it.
That's incredible. I'm so glad you had someone with that voice, someone you respect in the field who's like, look, this is the reality. It sucks, but here are the positives to look at. I mean, that's
Right.
incredible.
Yeah. So
So
he definitely changed the whole outlook on the situation instantly.
I'm so glad you had that, Lauren. And your husband, I know he was with you. I'm sure at that point you're getting checked in. Was that the point where he had to go home and figure stuff out, or?
So he stayed for a little while. He actually stayed to probably about the next morning, about 5. And then he left to go home, get the kids, and actually had to go to work. He was working, he didn't work at home at the time. So he worked away, he did a lot of traveling. And he was already scheduled to leave that next morning when all of this happened. So he took care, he got the kids settled. My mom ended up coming to the hospital. My mom actually worked at the hospital where I was diagnosed at.
Wow.
So it was convenient. But she was there pretty much on and off all weekend. She was there because he couldn't be there. My kids stayed between my aunt and my grandparents at the time while my mom was at the hospital. So it was, it was just an adjustment because I was used to always being with my babies.
I'm glad you had a support system, there to handle that part. And how did you break the news to your loved ones? I know your husband was with you, but with your your mom and your aunt,
Yeah.
and yeah.
So I actually didn't. My mom did. I couldn't do it. So she pretty much told everybody. And in my family is pretty close knit. So you tell one person, and then they're gonna tell everybody else. So
Mhm.
my immediate family knew from my mom, so pretty much from a direct source. And everybody else, I started a Facebook page that was named Fight Like a Girl. It pretty much followed my entire journey. And that's pretty much how everybody else found out I was diagnosed, how everybody followed my chemo treatment, and how my feelings emotionally and mentally and physically, and yeah, the whole journey was there for the world to see.
Yeah, do you have advice for people on how to, because, getting diagnosed with cancer, obviously, it's incredibly overwhelming and there's so much you have to focus on. Some people aren't sure how to break the news. Do you have any advice on that or anything you learned up until this point?
I think it's just to do it in your own way. Like there's no correct way to break the news. There's no, no balloons going off, and I mean, everybody doesn't, and a lot of people may not want to share the news. It may be something they want to deal with privately, but you just have to do it in your own way. For me, I was already into social media a lot. Like I was just on Facebook a lot. I was on Instagram a lot. So to me, it was just like, okay, just for coworkers and everybody else who were just calling and texting, and just to kind of let them know I'm not ignoring people, but right now I'm kind of going through something. So here's what I'm going through. So you all will kind of know. It was easier for my extended family to keep up with me that way. And and even like my kids' teachers and things like that. I mean, the schools were doing things for me, sending me things, and it was just easier for everybody to keep up with me just through social media. So, I mean, like I said, everybody may not want to do that. That may not be their thing. They don't want the entire world to know their business. But you just got to speak your truth in your own way. You just got to do it how you want to do it. And if, like I said, you don't want people to know, that's okay too. The world doesn't need to know that you have cancer if you don't want them to know.
Exactly. I love that message. I mean, no matter what and how people handle it, it's put yourself first, right? Just
Right.
don't worry about anybody else. I love that. So, going back to the treatment part of it, so did the doctor tell you, okay, he had said, okay, here's the chemo pills you're going to be taking. How did he lay out your entire treatment? Was it him or the nurse? And
So that's interesting too. So that doctor that I told you I worked for, um, already knew, of course, the top doctor that treated leukemia. He asked me, "Who's your doctor?" I told him who my doctor was. He said, "Nope, you're gonna have another doctor." And I said, "Okay." He said, He said, "You got who was on call at the ER. That's not who I want you to see. I need you to see the best. I need you to be okay." So I said, okay. So switched doctors on me. That doctor was actually on vacation when I got diagnosed. So I was seeing the nurse practitioners and the physician assistant until he came back. So and they were the best. They were super thorough. I'll forever be grateful for them. Then they were the ones that actually told me, this is the treatment plan, this is what we're going to do, along with the doctor who also diagnosed me because he was around in that weekend. So he kind of told me what the next steps were going to be, told me about the induction phase and how I was going to have to be in the hospital anywhere from 27 to 33 days. And that kind of took me over the edge. I was like, I cannot be in the hospital that long. I have kids. I gotta go home. And he was like, no, but you won't be able to be with your kids if we don't get this done. Like, we want you to continue to be around for your kids for a long time.
absolutely.
So at that point, he started telling me about, all the different chemotherapy drugs that I was going to have to take, how I was going to have to do 2 cycles of things, but that first we needed to get through this induction. And first I had to go through those first few days of just the pills, because he explained to me that my white blood count was so high that if they started intravenous therapy, they were afraid that the cells would disperse and literally go to my lungs and cause me to die. So they wanted me to start on the pills first so that we could get the number of cells down before we started intravenous therapy.
Gotcha. Okay, thanks for explaining that. So the oral chemo, that's the induction part, or?
So that was before the induction. So everybody doesn't need to do the pills from what I was told. It was just because my count was so high that they could not start with intravenous. They didn't want me to have any of those possible side effects from starting intravenous because my levels were so high.
Gotcha.
Um, So they wanted me to start the pills to kind of at least wean down that white cell count until it was a safe level. And I was on those pills for, I think, the first 5 days. I took the chemo pills before we started even doing anything intravenous.
Okay, so yours was a little bit of different maybe than what usual people go through because your
Right.
counts are so high. Okay, so after those 5 days, what was the, treatment regimen? Do you remember the
So the
drugs and how often you had to take them?
So I remember after that, everything was pretty much intravenous at that point. And I honestly cannot remember I really wanted to forget a lot of those drugs that I had to get for chemo. But I started, and they explained to me that it was going to be a cycle A and a cycle B. Cycle A, I would have to come in once after this induction phase. I would have to come into the hospital literally every month for 5 days, to get all of these drugs. But for the induction phase, it started off with chemo every day, being inpatient though, and they explained that I was going to be super weak, and I mean, it was just all decided I was going to be nauseous. And then I think after the first week of the first week of my intravenous therapy, they started explaining to me that the drug they were starting that second week was what was going to take my hair out. At that point, I just made the decision of I'm just gonna shave my head because I knew personally that I could not take seeing my hair fall out in clumps, just that process. I think that was gonna be harder for me. So I actually had my husband come to the hospital with his clippers and shaved my head in my hospital.
I was it like a bonding experience? Like, can you describe?
So I literally told him, I said, he was at home at the time. I said, today they told me that starting on Monday, the therapy that I'm going to start getting is going to take my hair out. I know I can't do that. That's going to break me down. And I said, so can you just come shave my head? And he was like, what? I said, because I don't want the little patches. I don't want to look like that. Like I feel like that's gonna make me look sick. I don't want to look like that. Like I'm still doing live videos on Facebook and and all types of stuff. I don't want to have patches in my head. Like, please come cut my hair. And he said, okay. So he came, he showed up, he had scissors and he had his clippers. He said, do you wanna cut it down and then I shave it? I said, yes, I do. So I literally stood there and cut my hair down and then he shaved my head, standing in the mirror in the hospital, in the hospital room.
How did it feel?
It felt fine. Literally, I think I took it better than anything after it happened. I was like, oh, I actually look cute. My son looks just like me, and I didn't realize that till I had no
Oh,
hair. And so, and the response was quite interesting as well. So after cutting it and posting the picture on Facebook, that's all I got was, oh my gosh, your son literally looks just like you. He's your twin.
I love that. That's adorable. We've got to get a picture of him up on your page to show people. And okay, so you're able to do that. The hair loss doesn't hit you the way it would because you shaved it off before it could fall.
Right.
Um, I actually forgot to mention you did get a specific diagnosis, right?
Yeah.
And
Yes. So at that
how did
time,
they do how did they do the specific diagnosis?
so I had to get the bone marrow biopsy. Once the doctor that my doctor I worked for had switched, once he came back to work that Monday when I actually started the intravenous, or that I think he came on that Sunday actually, and started the intravenous chemo. He he kind of, like I said, he told me everything that was going to go on, told me I was going to have to get a bone marrow biopsy because they really needed to lock down exactly which kind I had to, make sure I was going to get the right therapy. He told me he was pretty sure that I had acute lymphoblastic leukemia, better known as ALL. So they did the bone marrow biopsy, and it came back just like that. The biopsy was interesting because, like I said, I work for ortho oncology, and we did those all day long. So it was kind of interesting because it was in the hospital. I was not under sedation. I was wide awake, and I was literally telling them everything that they were going to do. And the nurse practitioner who was doing it thought it was interesting. She was like, I've never had a patient who could tell me what I'm about to do and all the instruments that I'm using. And so that was it, but that was my way of calming it down. Like I literally was talking myself through it. Like, okay, they just put the lidocaine in. Okay, now they're gonna let it sit a minute. Okay, now they're gonna make the incision. Now I was literally talking myself through it, and the fact that they were following it step by step, I was just like, okay, this is good. Nothing is gonna go wrong. Like this is a routine procedure. It happens all the time. They're gonna get it right because they're following all the right steps.
How interesting that you know the process. It's so different than usual patients.
Right.
So that's how you got through it. I was going to ask you if you had tips for other people on how to get through the bone marrow biopsy.
Yes. So that was my tip. Well, for me, that was it because I kind of knew what was going to happen. But just when I'm talking to other patients or things like that on Facebook groups and everything, I just say you got to remain calm. And even though we want to look up things on the internet, don't. Oh, that was the worst. Just looking up things and you're gonna get a lot of negative things out there, and it will scare the crap out of you. So it's real. I would prefer if just to talk to the physicians, and mainly the nurses. The nurses, of course, they see tons of those patients day in and day out. They've seen people get better. They've seen how other people cope with things. They are a really good resource because they have the time to spend with you. The doctors, they do, but they're in and out. They got so much they got to do. But the nurses have the time to spend with you, to explain what's going to happen, to say, okay, yes, I know they said you were going to have this symptom, but you may not have this symptom. And if you do, these are different ways we can treat it. It doesn't necessarily have to go down the same streamlined path that you saw on WebMD.
Absolutely. And stay away from the medical jargon online. I hear you.
Right.
Okay, so it's ALL, right? You do the chemo pills for a few days, then you start the IV. Did you get a PIC or a port line? A PIC line or a port?
Yes, I had a PIC line. I did not get a port. My doctor wanted me to have a PIC line because I did a lot of experiment. Well, they don't really call it experimental. They call it like trials. I did a lot of trials with my therapy. He told me because I was my age and the fact that I was completely healthy, I didn't have any cardiac issues or anything like that. I kind of did a lot of the pediatric treatment for ALL instead of the adult treatment. So he told me my chemo and my treatment was going to be a lot more rigorous than a lot of people on the floor with me. So he wanted me to have the PIC line. He said he wanted me to have a little bit more freedom than with the port. I actually wanted the port. I did not want the PIC line on the outside, but he convinced me that I should get the PIC line. So I got the PIC line.
And it worked well for you?
It worked well. It wasn't bad. I think you can see my scars.
Oh,
So
wow. You got the PIC line there where
yeah, so it was in my chest. I didn't get it in my arms, and I had it twice. But yeah, so you can still see my scars there. But yeah, so I had the PIC line. I guess it was easier maintenance, maybe. It never gave me any issues. I never had the infection at the PIC line or anything like that. So everything with that was very smooth. I never had any issues.
and the PIC line surgery, I mean, I know it's a small surgery, but some people get a little freaked out, right? Like they're going to cut that part open. Can you sort of walk people through that?
Yes. So for me, it was the people in the room. Like I said, the nurses and the OR techs were very calming. They were just like, okay, this is what's gonna happen. I was in the room and I was like, I'm freezing cold. They gave me an extra blanket and they were like, okay, we're gonna be cold for just a minute. And they were like, we want you to relax. They put a towel over my eyes before they gave me the anesthesia because I was freaking out in there. Of course, seeing the lights, it's just like a sterile room. It's just nothing there, and you just like, okay, I don't want to lay on this table and die. I don't want something to happen. I mean, you got to go straight into a major, my arteries and things. I want to live through this. And so I was kind of freaking out with that. I already had started to develop anxiety from it. So they put a towel over my eyes just so I didn't have to see the lights and all of the equipment around. And then shortly after prepping me, they were like, okay, we're going to go ahead and give you a little sleepy medicine. And they just, like I said, they walked me through the whole process. And when I woke up, I mean, they told me how I was going to feel when I woke up before they put me to sleep. So that was another thing. It was like, okay, this is what I'm anticipating when I wake up. I'm waking up. That's just it. I'm waking up.
So I hear that there's calming presence, and the nurses were a big lifeline for that.
They were huge for that.
So you get your PICC line in, things are good to go, right? And then so you got your IV chemo. Can you describe again? So cycle A,
Hmm.
because you're inpatient this entire time, right? So
Correct. I'm inpatient this
cycle
entire time.
so cycle A, is it like every morning for an hour or two?
Cycle A was, let's see, cycle A was, yes, it was definitely every day. I had chemo every day for 5 days. And it was about, mm, let's see, I would say for about 3 or 4 hours a day. I think I began getting two chemo drugs at that one time. The longest one I had was what they call the Red Devil, which was a 12-hour infusion.
Yeah, no one likes the red devil. And
Nobody likes the Red Devil.
then, do you
Nobody.
remember the side effects for the cycle?
Um, so from the Red Devil or just from it all?
Yeah, you can, if you could talk about the red devil and then just any other drugs you can remember. Or
The Red Devil made me very nauseous. Very, very nauseous. But I dealt with it via ginger chews. I chewed a lot of ginger chews. My mom went and bought me bags and bags and bags, and I did ginger chews, and I did a lot of smoothies that contain ginger as well. The part that freaked me out was that it turned your urine that ugly color.
Yeah, it's weird. It's like I had it too, so it's like the reddish.
Yeah, it's like that orange red kind of color. I remember like there was a I'm telling you, I was so open on my Facebook page. I remember taking a picture of it in the little urine hat, being like, y'all look at this. Like, what is happening?
Is it, and it's doxorubicin. That sound
Dr.
familiar to you?
Rubin. Yes.
Okay. And then cycle A, how many other drugs do you remember were part of that?
Well, I think total in cycle A was maybe 4 drugs.
Okay.
They
Do you
don't
remember?
definitely don't remember the names, but I think it was
Okay.
about.
No worries on the names. Do you remember the side effects that you got?
So yeah, those were about the same. The nausea was bad for those as well. I really didn't have too many other side effects other than nausea, which was amazing apparently. But yeah, the nausea was horrible. It was really really bad. And then I end up, because they were giving me pain medicine. Occasionally I would get like a little bit of joint pain or really bad headaches. And the pain medicine that they were giving me caused me to get constipated. The worst part of being in the hospital the first time were hemorrhoids. It was worse than any pain that I felt from any infusion and treatment.
I mean, it's real, right? Like that
Yeah,
constipation is next level.
yeah,
And it's interesting how you talk about it, right? Like you got a medication to solve this other side effect, but then that led to this other side effect.
right. So
So
yeah, it was oh yeah, it was horrible. I had never had anything like that. And that's what the doctor kept telling me. He was like, if I could get you to feel better from these hemorrhoids, you would be like cruising through this thing. I'm like, yes, they tried everything. I had creams, I had the little balloon, the little donut thing to sit on. I had sitz baths. I mean, it was horrible.
so nothing really helped with the constipation and to the hemorrhoids.
Nothing really helped with that. Eventually they had me drink the magnesium citrate.
Hmm.
And I end up having to drink 3 of those to finally go. And it was so painful when I finally went. I was in tears.
Yeah, but at least it finally cleared your system. Like you,
Yes, it cleared my system probably at like day 4. And yeah,
wow.
it was horrible. It was horrible.
What I'm hearing from you too is like just keep trying things and you can keep asking them, right?
Right.
For
Like you gotta speak up, don't just take whatever they're telling you of, oh, it's gonna pass, it's gonna pass. I'm like, no, I gotta have help. And even the nurses were telling me that. They were like, you don't call often. Like you're not on the call like all the time. So when you're on the call, like we know you need some help.
and this is when that light was on, I'm sure.
Right.
So your cycle A stops after 5 days or so, and then cycle B, does that start right away, or do you have a break time?
So it was a break. I believe when I was in the hospital for the induction phase, there was like a 2-week break. It was a good little break from that. And I really just dealt with a lot of the side effects from that first round. And then they had me on like the anti-nausea and just kind of watching my counts. at that point. And I think I actually had 2 bone marrow biopsies even in that time. Oh, they started the spinal taps. I had to start getting the chemo in my spine.
Can you
That's
describe that? Why did they have to do that?
So they had to do that because they said the chemo that was given to me intravenously does not go to my spine, and a lot of times people will develop, will continue to have ALL in that those cancer cells will still be there. So they had to do the spinal taps and actually put chemo directly into my spine.
Wow, that's sounds pretty intense. Can you describe the spinal tap procedure for
That
people
was
who?
painful.
Okay.
That was painful. Yeah, that hurt. There's nothing you could really do for it. They would give me anxiety medication before they started because I would just freak myself out with it. Probably because I had bad history with both of my kids with my epidurals. I was I
Uh,
was just like, don't want anything going into my spine. With my daughter, they had to try 3 times to get my epidural, and they were just like, your spine is not right. And I'm like, nobody's ever told me I had scoliosis.
yeah. So you already
So
had anxiety, and then what exactly are they doing? You don't have to say it in medical terms, just for patients who haven't are about to go through it. You know,
oh no.
okay, so a little bit of a technical difficulty. We're back. So Lauren, you were talking about, I believe, the spinal taps, and
Yes, yes.
yeah, if you could continue talking about that.
So yes, those were I was getting anxiety medication. They would come in and give that to me probably about 45 minutes prior to me getting the spinal taps. And at after the first time, they pretty much it was kind of standard for me. They were like, she takes the pain really well, she follows directions, but you gotta give her something for anxiety prior to, because otherwise she's just a nervous wreck. I would have to sit like on the side of the bed. They would bring my bedside table in front of me, put a pillow on it, and I would have to lean forward with my face like in the pillow. It's a very quick process. It's just nerve wracking because you know that someone is at your spine. Like, anything could go wrong with that moment. And I would say for the first 3 times that I had it, um, I was yeah, and the first 3 times I had it, I was inpatient. And they were great. I generally had the same nurse practitioner did it every time. That fourth time I had it outpatient, and because I had had it so many times at that point, I kind of knew what it felt like. And when I had it outpatient, it was so painful. I was literally telling him, like, you're not in the right spot. Like, you're not in the right spot. And he was like, no, I'm there. I'm like, no, you're not, because it hurt really, really bad.
Oh
um,
man.
and that was kind of traumatizing for me. So every time afterwards, I would say, if I have to have a spinal tap, please let me do it inpatient. Like, before I go home, or whatever needs to happen. I don't know if y'all can pull the nurse practitioner from the hospital when I have to have it in the outpatient setting. Something's got to happen, because I can't have that person do it again. It was traumatizing.
So you were able to learn, okay, I want the nurse practitioner and not, I don't know, was this like a different doctor or something who was
I
doing
think
it?
he was a physician's assistant, but he had only done them outpatient. He had never done them inpatient. And I think it's just once you get comfortable, you kind of, with different people, it's like, okay, this is gonna be fine. And when you have that bad experience, that's the one thing that sticks with you. It's just like, no, I don't want to have that done ever again. I
Right.
mean, I was in pain. It had me crying, on top of the fact that they didn't want to really listen to me, as far as I gotta have something for anxiety first, because you're gonna want me to be relaxed. You're not gonna want me to be tense while all this is
Right.
happening.
Absolutely.
And they were like, well, we don't have that in your orders. And I'm like, well, it's you guys still in the same system as the hospital. It's just as simple as asking my doctor, can you give me something for anxiety? He knows I get something in the hospital for anxiety.
Right.
um
Right.
so I think that had a lot to do with it as well, is that I was tense during the whole process, and then it was just very painful, and I oh god, it was that was bad. That was yeah, it was bad. It was very, very painful. And then, because you're wide awake, he's like, oh well, maybe I should go a little bit to oh, don't do all that talking when you're back there and I'm wide awake.
Yeah, pro tip, please keep that to yourself.
Yeah, like please don't do all that. You know, it's just I'm like, okay, I know you want to talk, but don't talk about that. I'm
Right.
sitting right here.
So the spinal taps you had to do a few different times.
Yes.
And you were talking about the break in between chemo cycle A and B. Was
Yeah.
were both cycles inpatient or was
So yes, so both were inpatient. And then I went after the first B cycle. I went home for maybe 2 weeks, and then I had to come back in the hospital for 5 days to start it all over again. So every 27 days, 21 days, I was back in the hospital.
how many times did you have to go in?
So from January till July.
Okay, wow. And can you describe that site, like, that treatment regimen? So you'd go in for 5 days. Was it chemo every day or was it chemo just the first day and
It was
then?
chemo every day. When I went for a cycle, I believe. No, that yes. So for a cycle is when I would get the red devil. At the end of that. So once I would finish that up, I would go home. It didn't matter what time it finished. They were like, if it's 10 o'clock at night, they would discharge me because they knew I just didn't want to be there. I would rather go home and be with my kids and lay in my bed. So that I would do chemo those first 3 days, and then it would be like a slight, I would say like a day break, and then they would start the red devil that evening, or depending on what time I actually got into the room when I would do my direct admits, would determine what time they would start the red devil on that last day and what time I would leave.
So the chemo, what were the differences between the drugs between A and B?
A was very harsh. A was very, very harsh. B was a lot less mild. I loved B. I won't say I won't say I loved it, but compared to A, I preferred it.
Yeah.
I would literally be excited like when I finished that first A cycle, and then after maybe about, I would say about 4 days of bad nausea and bad side effects, it would be like, okay, but next time, the good side to this is next time we're doing B cycle and you don't get any side effects after B cycle.
I see. It's alternating A, B,
Yes,
A, B.
A B A B.
So after with B, the side effects wasn't too bad, is what you're saying. Can
No,
you list
B
any
the
of
side the side effects weren't bad at all. Like B, I rarely had any side effects with B. Any. They were giving me sodium bicarbonate that I had to take prior to. So I think it was like 5 days prior to coming in for my B cycle. I would get that because of the type of drug that I was getting in B cycle. But it did not. I had no side effects from that.
And then for cycle B, was it chemo every day for those 5 days or
Yes.
okay.
Yes. Still chemo every day.
Any tips for people in terms of, you had a very long hospital stay in the beginning and then you were going in every 3 weeks for another week
Mhm.
long stay. What helped you through the hospital stays?
So I did a lot of. I actually started a business while I was in the hospital.
Wow.
um, so I started that from the hospital bed. I watched so much Food Channel and HGTV. It was ridiculous. I had all types of plans for everything, um, as well as just, I think, family. Really, just everybody. I couldn't really have that many visitors because you have no immune system. So they kind of got you on those contact precautions where everybody can't come see you. But I did a lot of FaceTiming, did a lot of talking. Again, I started that Facebook group. So I was on there a lot. I got involved with other groups on Facebook for just support groups and stuff for leukemia and lymphoma, where I could ask a few questions or say, hey guys, I've had these type of side effects. Anybody else had them? And it just kind of helped me see that I wasn't alone. I did do a lot of researching on the symptoms and things that I could do for the symptoms. It's just, I don't know, everybody deals with it in a different way. Just from being in those groups and talking to people, and even talking to people when when I was in the hospital, just getting laps in the hospital and talking to people, it everybody deals with it in a different way. Because everybody gets diagnosed differently. You know, it's not a streamlined process of this. If you get this symptom, and then that means you have leukemia. Like, everybody is different. Everybody's family life is different. Everybody has different cultures, different backgrounds. So it's just, I think the biggest thing is talking about it, though. Like, don't try to hold it in. Talk to somebody.
Yeah, no, that's good. Just an outlet, right, to let the emotions
Right.
out. So I wanted to ask also about the scans. Did you do a scan before you started treatment?
So I did not do a scan before I started treatment. I did one right before I started the intravenous treatment. Yes, but before the actual oral chemo, I did not. But before they started the intravenous, they did do a scan.
Do you remember what kind of scan it was and what it showed? PET
I don't
CT?
know. It was a CT. It was a CT scan.
Was there a contrast? Do you remember?
It was CT contrast, which is the first time I had ever had a CT with contrast. And they did that basically just to see how my lungs look, is what they told me. Make sure I didn't have any lung nodules, because my count was so high they didn't really know how long I had been dealing with it. So they wanted to make sure that I had no metastasis or anything, is what they told me.
And
And
there,
I didn't.
okay, good. No metastasis.
Nope.
Perfect. And that contrast dye, you remember feeling like you had to pee and all that, and
Yep. I remember it being warm and feeling like I was going on the cell.
so yeah, heads up to anyone who's watching or reading this, right? It's
Right. You will feel, and they did warn me of that. They were like, "You don't feel like you're peeing on yourself." I'm like, "No." And as soon as they gave it, I'm like, "Yes, you do."
outside of that, pretty harmless though. No
Yeah,
pain.
no pain.
So then, when was your next scan? Did you do a scan before radiation or was it after?
Yes. So I didn't have a scan again. So I ended up in June. In June, they told me I had a donor. Because they immediately told me I needed to have a bone marrow transplant, and I had to have a donor. I couldn't do the what is it, the autologous, or whichever
Yeah.
one it is, where you could do your own. I had to have a donor for that. So they looked at Be the Match. There was nobody on Be the Match who was compatible for me at that time. And then they told me they would start testing family members. And if any of my family members wanted to volunteer, I could let them know. But they were going to start, because I have no siblings, they were going to start with my mom and dad, and then any other family or friends who wanted to volunteer, they would test them. Um, they started with my dad, I believe, who is terrified of hospitals. So terrified of hospitals that my dad never came to see me in the hospital. He only FaceTimed me.
Yeah.
He was just like, "Baby, I can't do it. I can't see you like that. I can't see you like that." So
Mm.
he never came the entire time I was there. My mom was there almost every day.
Mm.
But they started with my dad and tested him and did the lab work and all that stuff. And then they did lab work on my mom. And one of my cousins, they got to him as well and tested him. And then they kept calling my mom back. They kept telling her they needed to get more labs on her. They wanted to get more labs on her. And then in June, well, no, it's about the end of June, I would say, my doctor told me that I had a match. So I said, okay. I was like, well, who is it? When is it going to be? And all of this. And so she says, well, you're going to have an appointment in the office next week, and we're going to discuss everything and start the process of everything. Um, I said, okay, great. Like, I was all excited. I'm like, okay, did you find this person on the registry, or what happened? So my mom went to the appointment with me, as she normally did. We were sitting there, and she said, "So you're here because I found you a match." And I said, "Oh, great." I was like, "Okay, so when is all this happening? You told me once you found the match, I didn't have to do like my cycles anymore. I didn't have to do my last cycle of chemo. So this is great. Like, we're moving forward." So she was like, "Yeah." She was like, "So here's your match," and she handed me a piece of paper, and it had my mom's name.
Wow.
So I was like, "My mom is gonna be my match?" And she was like, "Yeah." She was like, "Generally, a lot of times parents aren't as high of a match as your mom is for you, but she's like a 7 out of 10." I was like, "Oh." And she was like, "This day and time, things are so advanced. 7 out of 10 is perfect." I was
Wow.
like, "Okay." So my mom ended up being my donor.
And wow, that's amazing. And did your mom find out right then too, or?
Yes, she found out right then too, and she said, she was like, "I kind of felt like something." She was like, "Either something was wrong with me, or I had to be a match because they just kept having me come back and get lab work."
And so that's awesome. I mean, amazing news. It's your mom. She's your match. What happened between then and the transplant? I know you did have radiation. What else
Right.
did you have to go through?
So I did. They had me admitted. I want to say 2 days. I mean, 2 weeks prior to the actual transplant date. But in between that time, my mom had to go through all of her testing and everything, and found out that she had a sickle cell gene. So they told us we could not do it just with her doing the intravenous where, they just go ahead and extract it. She actually had to do the surgery where they did the multiple bone marrow extractions on her iliac crest as well in her back.
Um,
So she started prepping for that. They had given her different medications to build up the cells and everything. So she started that. Then 2 weeks prior to the actual transplant, I went into the hospital. They did total body radiation, which was I went and laid on the table. I would say 45 to 50 minutes twice a day for radiation for 5 days. That was hard. That broke me down. Yeah, that made me super weak. My mouth was always really dry and hurting, and yeah, that was just bad. Eventually, it kind of felt like like your skin is just peeling a lot. That the radiation was very hard on me. That made me sad. I think that was the first point where I really was like, this is hard. This is cancer. Like this is not fair.
can you the radiation? I didn't personally experience radiation. What's that process like? You're going in, having to lie down. Yeah.
Yeah, so you go in. So everybody is, I guess, is different. Sometimes they have to target certain areas of your body, which have you to have the different burns. And like I said, working in oncology, that I was freaked out because I was like, oh my God, they're talking about total body radiation. Like, oh my God, I'm gonna be burned all over. Like, what is gonna be happening? And my doctor explained it to me like, no, it's not that high. It's small amounts of radiation, but through your whole body. So it's not large amounts to one part of your body. So I said, okay. So he was like, you should not be burned anywhere. But I literally went and laid on a table. And it was like a big ray gun, I guess you could call it. That was literally over top of me, and they would play music for me in the radiation room, and I just had to just lay there, and I was getting radiation to my entire body. They had a face shield that they kind of put over me because I wasn't getting it to my face or my head. So it kind of looked like a little helmet that they would put on me. And I would just lay there, and this machine would just go from side to side. And then they would tell me to turn over to my right side, and it would do its thing over there, and then turn over to my left. And all you can really see is like these lights moving around. It doesn't look like you can see a beam of anything, but it's just these lights moving around. And
Yeah.
but once you finish with it, something has happened to your body. Like it, yeah, the side effects of that were very bad for me. I didn't get any of those harsh side effects with chemo. Like I said, with my mouth soreness and dryness and just total weakness with that. It was yeah, I hadn't experienced that the entire time I was going through treatment.
So weakness, fatigue. You said dry mouth. You said mouth sores too, or?
I had a few mouth sores. They weren't really bad, because that's what I was most scared of. That was what everybody kept telling me. Even my doctor was like, "You will probably have mouth sores. Most people get really bad mouth sores." I may have had two mouth sores, and they weren't bad. The biggest thing with the mouth sores is they say those cells that rapidly multiply is what it targets. So your mouth won't heal as fast. So I was thankful that I did not have mouth sores because that's what causes the pain is that you have like these canker sores that don't heal for a while.
Right, right. Anything else you want to say to people who are going to undergo total body radiation that you think would be helpful?
Um, with I really there's really nothing you can do to prep for it, unfortunately. There's nothing you can do to prep for it. With the mouthwash, I think they give everybody the biotine. Definitely use it. is definitely helpful. Even if you don't have the mouth sore, swish it around. Just when you're just sitting there with nothing to do, just swish your iodine around in your mouth. Keep your mouth moist. Drink if you can. It totally took my appetite away. I did not want to eat after radiation or anything like that. So I would say be prepared for that. I drank a lot of smoothies. I had my mom bringing me a lot of smoothies. And apple juice was my favorite. It kind of kept me going because I didn't want to eat for about those 5 days of total radiation. It was horrible. My stomach was just it just didn't want any food. Nothing tastes the same. Taste was gone in my mouth. So I just like I don't want it because it doesn't taste good. It doesn't look good. It's not nothing looks appetizing. And anything I put in my stomach, it was already just
Right.
making me nauseous and sick. And oh yeah, it was horrible.
Yeah, no, I hear you. Thanks for sharing that with people. I see that you then actually you stopped radiation August 25th. Your transplant was the next day. I mean, it was like
Yeah, it was very fast.
incredible.
It was very fast. And that's how they planned it. So they we're gonna kill all of those cancer cells, and then immediately we're gonna put those new cells from your mom, the donor cells, into your body.
Can you describe the transplant process?
Yes. So my aunt was there with me in the room. My mom was downstairs, getting off the harvesting and everything. The doctor immediately came upstairs. They had the bag that looked like I was about to get a transfusion. It was huge though, and she was like, "These are your cells," and she hooked it up. They put it into my port, and it's immediately started going. Like it was no in between, no pause, no nothing. It looked like she got undressed from the OR and immediately brought them up to me. It was less than 30 minutes from the time that my aunt called me and told me my mom was fine, she was in recovery, and the doctor was then in my room.
Wow.
uh, so they started that then, giving me that. That's honestly when I started getting my transplant. I fell asleep. They gave me something to sleep, and when I woke up, I was so hungry. I just wanted to eat. I don't even remember who was there because that was blurry at the time. I remember telling whoever was there that I wanted a 10-piece nugget from Chick-fil-A.
Good choice.
And so I got that 10-piece nugget. I have pictures of me sitting there with a big platter of nuggets in front of me, and that's all I'm eating is Chick-fil-A nuggets.
What a memory.
I couldn't taste them. They didn't taste like anything. I can still remember they didn't taste like nuggets. I kept dipping them in sauce, couldn't taste the sauce, but I wanted to eat and I wanted those nuggets.
So that's a nice first memory when you're awake.
Right.
What happened after? Like, how long were you recovering in the hospital?
So after that, I was in the hospital for another 20 days. The after the transplant though, they allow you to do engrafting is kind of what they call it. So they allow your cells to kind of rage and kind of the new cells to try to kill off the old cells and let them kind of battle within your body is how they described it to me. Then they give you chemo that kills all of the cells, and hopefully only thing that's going to come back is those good cells. So they gave me Dilaudid, high doses of Dilaudid, which knocked me out. I did not feel any of it because they said the side effects of the chemo is that it feels like your body's on fire. It burns really bad. So they gave me high doses of Dilaudid, and I literally every morning at 8, yeah, at shift change, so like 8 o'clock, she would come in and push the Dilaudid, and I probably wouldn't wake up till about 8 o'clock that evening.
Wow. And was that every day while you
that
were?
was that was for 2 days immediately following. I think it was like 4 days of letting the cells kind of do what they wanted to do, and then on day 5 and 6, they gave me the chemo and the Dilaudid for 2 days though, and then after that they kind of let it do its thing, and then that's when you start your journey, which is your first 100 days is what they generally call it. Because those are your hardest days. Those are the days you don't want to eat. Those are the days you don't want to talk. Those are the days you may not even be able to get out the bed. those days are hard because your cells are rebuilding, and it's going to take time. It's just not like they just click in and they start rebuilding. You got to wait a few days. You got to wait till, I mean, it took a while. I ended up being in the hospital total from the time I went, I think it was exactly 32 days
Wow. Okay.
before I could even go home. And like I said, they label it the first 100 days because those 100 days are hard.
They're tough. And so you actually still had 2 months to go, more than 2 months to go
More
at
than 2 months.
home. Yeah.
Yep.
Can
Yeah.
you describe that the remain like the rest of the 100 days at home and how you handled that?
Yeah, so starting out, I was actually having to go to the doctor every other day, 3 days a week. I was at the doctor. Um, that was that was hard. It really wasn't every day I wasn't seeing the doctor. I think I saw the doctor once a week, and on the other 2 days I had to go to the lab just to get labs done so they could test my levels. And then once a week I had to go so they could look at my anti-rejection meds to see if they needed to be altered or anything like that. So they would look at my labs and say, okay, well, we need to go up on this one and we need to go down on this one. I did really good though, because I think in those first 100 days, I did come off one of them because one of them was just too much for me. It was making me sick once my count started to rise again. And so they told me, they were like, okay, well, we're going to take you off of this medication and just leave you on the other, which worked out well because I mean, I was really nauseous from that medicine. I mean, it would feel like I had ulcers, like my stomach was burning because I was just throwing up so much. It was horrible.
So what helped you the most get through that period?
Um, that now, that period that was the hardest. Through my whole entire journey, those 100 days, mentally and emotionally were my hardest. I did a lot of crying when I first came home. It's like, okay, I've beat this. I've had the transplant. In your head, everything's going back to normal. Like, yeah, they say 100 days. It's not, nope, but it's going to be just fine. I can do this. I can do that. And I couldn't. I remember breaking down in the kitchen one night. My neuropathy in my hands were so bad. And one of my kids wanted a peanut butter and jelly sandwich. And to take the twist tie off the bread hurt so bad because my neuropathy was so bad, and I just broke down in the kitchen because I was like, I'm not normal. Like this is not right. Why am I going through this? This is not fair. Um, so yeah, that was just hard for me. I look back on it now and I'm like, how did I even get through that? Because that was a lot of crying. That was emotional. At that time as well, I started going through separation with my husband. So it was just, yeah, it was very trying.
Yeah, actually, that's a really common question, right? Is how cancer can also impact relationships. I'm not saying that's the cause of anything, but
Right, but
it,
no, you're
yeah,
right.
yeah. Can you? I mean, can you share some of that, like how
Yeah,
cancer? Yeah.
I definitely can. So yeah, I think I really go back to, I just don't think he had he had an outlet, but just because the type of person he was, he internalized a lot of things. And I think the way he dealt with it, every time I was doing therapy in the hospital or outpatient in the clinics, I was like, come on, go to therapy with me. He was like, no, 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 like, I don't need therapy. I just need you to be all right. I just need to make sure you're good, blah, blah, blah. And I was like, no, like, at some point you're gonna, he had not cried in front of me dealing with this the entire time. And I was like, I don't know if you cry at home, but at some point, like, you got to release this. Like, you are going to have to face the fact that I have cancer, but we're beating this. I'm not dying on you. I kept telling him that I'm not dying on you. I'm not leaving you here with the kids. We're gonna get through this. That was just my affirmation to myself. Like, I needed that for me. But I think it came down to, he was having a hard time dealing with, I couldn't be the person that I was. Um, I couldn't do a lot of the cooking and the cleaning and things like that. And it wasn't that, he was just like, oh, she's lazy. It was just hard for him to come to grips with. And because the communication wasn't strong anymore, because he was just internalizing everything, it made it even harder. It made it frustrating for me. It made it frustrating for him. So yeah, I never blame cancer to say, oh, cancer ruined my life. It ruined my relationship. But it made things hard, and you never know how other people are going to deal with it. Yeah, it was easy for me. I wouldn't say it was easy. It was it was easier for me to stay positive because I was going through it. I think it was harder for him to see me going through something like that because I was military, so I've always just been strong-willed and just doing what I need to do to get things done. So for him to see me kind of helpless somewhat, I think it bothered him.
Yeah, there's a lot of change and trauma and identity shifting and role changing and all that kind of
Right.
stuff. But these are the things that we don't really think about going into cancer, right? It's like we got to save our
Exactly.
lives, obviously, but
Exactly. Those are the things people don't tell you about, that your relationships could suffer. Not saying that it's gonna quite go the way mine did, but you're gonna have to find something else um, that you guys can lean on that makes you happy because the old you is not there. That's for sure. You're not your normal self.
yeah, no, I'm so glad you shared that. Thank you, Lauren. When we hear that with a lot of people, it can go either way.
Yeah.
Before we get into, I just have a couple more questions, but before we get into the emotional part of it, the transplant, the 100 days are done. What happens? Like, do they just monitor you or do they do a scan?
Yes, so they monitored me. I was still doing bone marrow transplants at that point. I mean, bone marrow biopsies at that point. Um and then other than that, it was really just a lot of monitoring, a lot of lab work, a lot of follow-up weekly. I think I followed up multiple times a week for about the first 4 weeks, I believe, once I got discharged from the hospital. Then after that, it started trending down. So it would be 2 times a week. Then it would be 1 time a week. And then it would be like once every other week. The further you get out. And then I finally then I started to backtrack because they started to try to wean me off of the medication. And then I began to get GVHD, graft versus host. Um, and I'm still battling with that now. So I am still on 20 milligrams of prednisone every day.
Actually, yeah, could you, I mean, that's terrible. I like, having to deal with still the steroids years out, but the GVHD, if you summarize your experience with that.
Yes, so my GVHD is it targets like skin. So I will start to get these rashes really bad. And also it targeted my lungs, which is where it has kind of settled. So I would just get these coughs that would just last forever. They were really strong, hard coughs when we would try to decrease my medication. I was able to come off the anti-rejection meds, but I think I came off the anti-rejection meds right before I hit a year. Yeah, right before I hit a year. I finally came off of all of those, but I have not been able to shake the prednisone. If I don't take my prednisone, and in the age now of coronavirus, somebody is going to think I have it because I will cough and cough and cough and cough. Because, like I said, settling my lungs, I get pneumonia about 3 to 4 times per year.
Wow. Okay.
It has just become a standard for me. I know when the seasons change, I feel it, and I literally just call the doctor. And she's like, all right, let's come in, let's get a chest x-ray. Okay, yep, let's get you your antibiotics.
Mm.
This time was a little bit different. I got it in March with everything that's going on now. And I work at the same facility. I now work at the same facility where I'm treated at the same hospital. So they had sent me home to work from home because they were like, you're extremely high risk. This is a respiratory virus, and you're high risk because you have GVHD in your lungs. You can't work. You can't work here. You got to go home and work. And I came home, and it was probably about that first week I was home, I was fine. About that Tuesday of that first week I was home, I started to feel it. I started to get the cough, and then my chest started to feel a little heavy. So I got tons of inhalers. I got the nebulizer machine and everything. So I started getting out everything. I'm like, okay, make sure you take your prednisone every day, same time. As soon as you wake up, you got to take it every day, same time. And so I started to do everything that kind of sometimes will combat it, but if it's pneumonia, I mean, it goes from 0 to 100 very fast.
Mm.
And I ended up calling my doctor, and I was like, I think I have pneumonia. Matter of fact, I know I have pneumonia. And the nurses were like, okay, well, no, you got to call the COVID hotline and blah, blah, blah. I was like, ma'am, please just send this message to the doctor because she already knows me. Please don't, I'm not trying to go to do any of that right now. I was like, I'm struggling. Like if I can't get her to call me back in an hour or two, I'm gonna have to go to the emergency room. And I know she don't want me to go to the emergency room. She never wants me to go to the emergency room. So she called me right back and she said, hey, she says, I'm calling in and I'm sending in antibiotics right now. She was like, normally I would have you come in, but I can't have you come in here and be exposed. She was like, I mean, you have it enough that you know exactly what it feels like. She was like, but I don't want you to come in here and be exposed. I'm sending you in the antibiotics. So I called my mom and I said, could you please pick up the antibiotics for me and from the drugstore and bring them to me? I said, they'll probably be ready shortly. So as soon as I got the alert to my phone, they were ready. My mom picked them up, brought them to me. And in about, I would say 24 hours, I was on the road to recovery again. So it's just, like I said, I now know the symptoms because I have it so much. But yeah, if I'm not on the prednisone, I feel horrible. My energy is gone. My skin starts to break out and I begin to cough. So it's an uphill battle all the time. It's not just you finish the hospital or the intravenous stuff and it's over. You know, you always are dealing with some form of it. I now have bad joint pain. Not every day, but definitely when it's cloudy, like today, it's not a great day. It's about the storm. So all day my hips have been hurting. I have AVN, avascular necrosis, a little bit in my hips. I have knee pain. So it's just, you know, your whole life changes. It changes your whole life. It's not just okay, I had cancer and now it's over. I wish it was like that, but it continues to rear its ugly head in my life every day.
You know, I really appreciate because you addressed exactly what I was going to ask you, and it's the issue of survivorship. And I want to double check though. I mean, you're considered in remission? You just are
Yeah,
dealing with GVHD, right?
correct.
Okay,
Correct.
so that's really good news. And your energy, Lauren, is clearly very positive, and I know that cancer has done a number and changed so many things in your life. So I guess my last question to you is, on that note of survivorship, and having to deal with the joint pain and all these things, like what's the best thing that's helped you move forward through all of this, and I guess the second part of that question is, what would your message be to people in your shoes?
Right. So I think the biggest part of that is just knowing you gotta tell yourself you want to live, and you gotta tell yourself that this is still better than what it could have been. Yeah, my whole life changed January of 2016. Like everything was flipped upside down. But I'm also here. I still get to socialize with my family. I still get to see my kids. I still get to raise my kids. I still get to just have a life. I mean, I could have been 6 feet under easily. So it's just all, to me, it has always been a positive approach. I won't tell anybody that every day is a good day because it's not. That would just be a complete lie. Some days are really hard emotionally, dealing with anxiety and things like that. Some days it's just hard. I'm just somber. Some days I just want to lay in the bed, and I just have to really push myself to keep going. Honestly, my faith kind of keeps me strong as well. Just trying to maintain, just try to keep my mind off of it and just see the glass half full and instead of half empty. Because things could be much worse, for all of us. Like everybody who is now a survivor, or everyone who is in remission, or even all of us who go through treatment still. Like you're still here, so we gotta just play off of that. We're still here. Things could be worse. There are people who didn't make it. Who it was too late when they found out, or they didn't make it through their first treatment. We're still here. So we got to be positive.
I love that. Any last message for people in your shoes?
I really think that's just it. Just remain positive, remain strong. Just fight it. Like don't let it get the best of you. Fight it. I mean, with every inch of ounce every inch of being, you gotta fight it. Don't lay down. Don't let it take your happiness. Don't let it take your joy. Don't let it take your life. You gotta fight.
Wow, thank you so much, Lauren. Really, you're incredible. So happy that you're able to join us today, and really thank you for your time.
Thank you for having me. This is great. I love this.